Welcome, welcome. We're going to give it another couple of moments for folks to be able to join. And then we will be getting started. We appreciate you giving us your time to talk about this topic, and we're very, very excited to go into detail with y'all about civic engagement in the healthcare setting. We'll get started. Just testing if everyone can hear me. Can you hear me, Jessica? Awesome. Okay. All right. Sorry about that. For folks who are just joining, we're going to go ahead and get started. If you're able to drop your name, where you're from, what you do in healthcare, that would be great. And we are excited to welcome you and get started. We'll use the full hour, so we'll get started in a couple of moments. I'm Stella Sacco. I'm one of the leads of Civic Health Alliance, and it is a pleasure to have y'all join us. Wonderful. Welcome, Tyler. Thank you for joining us. We have a student ambassador program that we will be glad to tell you about when we get a moment. And our colleague, Jessica R., may just shoot that over for you so you have that at some point. All right. So we are super excited to welcome everyone here. We have a very engaging session, we hope, for you that's about increasing civic engagement in healthcare settings. Russia, would you like to introduce yourself real quick?
Hi, all. My name is Russia Chavez Cardenas, and I am working with Civic Health Alliance. I come to the organization from the policy perspective, and so not necessarily the medical perspective, but I really like sitting at the intersection of civic engagement and health. So thank you for having us today.
Awesome. And I'm Stella Sacco. I'm an HIV primary care physician and one of the founders of Civic Health Alliance. And I am so excited to be here with y'all today. And our colleagues, Jessica Rabazar is on, who is the lead of our social media engagements and also a rising or an MS4 going into residency. And Jessica G, who's our research associate, is on as well. We are very, very excited to come to you as a Civic Health Alliance team because this is the quiet before the storm. We are about to head into an election year. We like to get ready. We like to stay ready, rather, so we don't have to get ready. And so for us, this is our way to really think about how we can get ready. And in our time together today, we're going to be defining civic engagement and discussing why it's important, laying this foundation, because one of the biggest questions that we get is, why are healthcare workers talking about this? What does this have to do with health? And really making that connection with a case study so you can understand what it looks like in a real world setting. And we're going to learn how to increase civic engagement at a couple of levels. We want you to walk out of here and have a good sense of kind of like Civics 101, but also what you can do and what tools you can have that'll help you to do this work and do this work well. So our goal is to increase your knowledge and your comfort so that you can be a partner with us as we think about how we can improve health through civic engagement. We want you to ask questions. We want you to use the chat. We want you to share your best practices. And so I'm really going to encourage you, if you haven't already, just drop your name, where you're calling in from, where you are in healthcare. And as we talk, you're going to see information come from us, links to things that'll be helpful, documents that we think you may want to hold on to. But please feel free, if you have things on your end that you would like to share, to do so, because we definitely feel like this is a collective effort that we would like to be in with you all. So at the end of this, your questions will be answered. You'll have tools and resources. And best of all, we hope that you'll have a community that you'll feel like you can really rely on going forward. We certainly are in your community, but others who are on would be great as well. So why are we focusing on this? And I'm going to start off with a couple of questions for y'all, okay? And the first question that I want you to think about as a healthcare professional, and whatever level that you're in, is, what makes it hard for you to do the work of bringing civic engagement into healthcare settings? So where you're sitting, whether as an attending or a medical student, or what makes it hard for you to bring this into the healthcare setting? Is it that it seems too political? Is it time? Is it not knowing enough? Is it not really feeling comfortable with being able to do this? And just take a couple of moments and answer honestly. This is, after all, anonymous. And this gives us a sense of kind of what we'll talk about today and how we focus our efforts going forward. And so as we take a look at this, what we're seeing is a lot of people are saying, look, like I would do this, but I don't have time. Some people are saying, I don't really feel like I know a lot of the things that could be impacting this. And it seems too political, and some folks are not comfortable. And so with that in mind, I want to kind of go and talk about what would help you to feel comfortable. And so we're kind of like level set with you as to where your comfort is. And so if you're someone who feels like I feel prepared to bring civic engagement into my healthcare institution or school, let us know. This is a more directive question than the one that we just asked. And in part, we're curious because we'd love to be able to move you from maybe not as comfortable to a place where you feel more comfortable. Okay, so as these are coming in, awesome. And I'm going to go ahead and share with you these results. And so I think it's a pretty good mix, which is a great place for us to start because we're going to go a little bit of a layer deeper in our conversation today. We're getting yes, definitely, yes, somewhat, and some folks are neutral. And then for the last question, excuse me. So this is kind of like a little bit of a kind of, a further question based on your training. After this training, I'm sorry, this is for us to come back to at the end of it. So I'll launch this at the end for us, but I want you to be thinking of like where you're moving. So as you've started with this kind of level of like, this is my comfort, I'm kind of comfortable, I think I can bring it. I want you to really be thinking for yourself of what would help you to feel even more comfortable to move this work forward. So why are we doing this? Why are we talking about this? Why now? And I'm going to present a certain portion of this to kind of level set, and then Rush is going to come in and present both a case study and a little bit more of the specifics from our policy background for you to walk away with a real sense of the what of this. So we're talking about this right now in part because of the impact of COVID-19, the incredible exodus of physicians out of the physician workforce, and the reality that we're in a place where we have to think about moral injury on us as healthcare clinicians. And so we believe that policy advocacy is one mechanism that we can use to address some of the social and political determinants of health, and that it's worth us thinking about how we do that, right? So if you're seeing all of the end effects of poor policies and not able to do anything about that, that's just going to drive us even farther into the kind of dismal state of healthcare that we have now. So we've created an engagement model at Civic Health Alliance that really has us, as I said, prepared all years, all the time, really, to think about how we bring in civic engagement and what that means. I'll define for you in a moment into the healthcare setting. A big part of what we do is we bring together individuals and we foster coalitions. What you're seeing to the left is one of the big investments that we made a few years ago into something called the Civic Health Compact, which we'll share with you in the link, which is a way for health institutions that are saying, you know what, like we don't exactly know what to do. This is a way, and these are just 4 representative activities. This is a way for healthcare institutions to have a blueprint to understand how they can help their healthcare workers that are dealing with some of the things I just mentioned in the previous slide, be able to be more civically engaged. And then for those who are saying, look, like I'm not a healthcare institution, I'm an individual. My healthcare institution would never do some of this stuff, but I can do some of these things. We have individual resources that allow you to kind of come onto our website, and we'll share that with you as well, where you can pick any of these and use them. The way that this works for us is that we use a QR code for you to be able to track your engagement. And so if you print a flyer that you put into your clinic, for instance, that says, I want to check my voter registration, or I want to make sure that I'm eligible to vote, we are able to help you to say, you, Dr. Thomas, have helped 30 people register this election cycle. And we actually do something with students where we help them to compete with each other at other institutions and see if that kind of keeps people going, keeps people engaged. But our website has a tremendous amount of resources, and this is part of our engagement model because me as a health an HIV primary care physician, I don't have time to create these things, but I will use them in the healthcare setting. And so what's the case for civic engagement? It all really relates back to the social drivers and the social determinants of health, all the way up to the structural determinants of health. Many of you that are sitting here know them. They're the economic, education, healthcare access, neighborhood and built environment, social and community context issues that impact health outcomes. And many of these, for example, social and community context, think about the criminal justice system, many of these are impacted by policies. And so we know that as we improve civic health, we have an impact on physical and mental health, and that all of these kind of relate to the space of social welfare policies that impact us all, depending on kind of where we sit in our societies. So our kind of idea with this is that if we know that our health is impacted by these social drivers, then there needs to be work that gets done that allows us as clinicians who take care of people's health pull on the levers that affects the upstream causes of poor health. And for us, that's civic engagement. So I want to define civic engagement for you. It's a term that we kind of use, but folks sometimes don't feel like they fully know like what it means. So civic engagement covers all the varieties of ways that individuals and collectives of people or organizations participate in communities and public life in service of addressing issues of public concern or improving community conditions. And this is really important here to note that the goal of civic engagement is for collective improvement. So I'm not really being civically engaged if I decide that I want to get new headphones. It's personal, engagement that helps me. But if I decide that I want to fix the sidewalks because it affects our ability to exercise as a community, that's an example of civic engagement. And what we do within civic engagement is really interesting because it is a wide spectrum. If you're one of the people like myself who's just tired of hearing people say vote, and that's it, civic engagement actually says it's everything from voting all the way to becoming an elected official yourself. And it's both responsive and it's proactive. And so it's things like when an issue happens, volunteering for this issue or activism for the issue, or being proactive and saying we have issues that we want to bring forward through community groups to our politicians for them to be able to act on. And so as I mentioned here, types of civic engagement, it's electoral participation, it's volunteerism, it's advocacy and activism, and it's organizational involvement. Many of you are already doing parts of this. And what we want for you to do at the end of the session is to feel more confident and to feel kind of more directive in how you'll be able to continue to do this for the health issues that are impacting your patients. So the health impact of civic engagement are many. We have seen studies that have tied increase, and I'm going to go through some of them just in a moment, increases in civic engagement being tied to higher income, higher education, improvement in mental health. There's a large representative study in the US that looked at those who voted, or those who reported as having voted, also reported better self-reported health. And some of these things then correlate to actual measured chronic disease management. And so we know that civic engagement is one of those markers that we can think about that in and of itself actually has an impact on health and health outcomes. And these are some of the studies that I'll just quickly take you through. So a Swedish study looking at individuals who were about between 16 to 20 found something that they called positive social capital, or looked at something called positive social capital that's represented in that graphic that you see to the right. That's a combination of feeling self-actualized, community advocacy, and having good social supports. And it found that for men, opportunities for civic engagement when they were younger actually decreased depressive symptoms as they aged. Another longitudinal study looked at about 10,000 adults and adolescents and young adults, and looked at different forms of civic engagement. So we talked about the voting, volunteerism, activism, and that things like voting and volunteerism were associated with health promoting behaviors and improvement in mental health. Activism had mixed results, and I'll posit as someone who does a lot of different advocacy work that sometimes the mixed results may be coming from the reality that the outcomes are like negative, or the outcomes take a long time to achieve. And so the kind of attenuation of health promoting behaviors may be tied to that. And then there's this bidirectional association as well. A study of adolescents and young adults found that those who had depressive symptoms were less likely to be civically engaged later on in their adult life, but also civic engagement as a youth predicted lower depressive symptoms. And so it's hard to say which leads to what, but there are studies that are suggesting that there is kind of a positive impact that we can see. And then we start to kind of think about what this means as we look at places that have been historically disinvested in and what their civic engagement kind of markers look like. And so one study for where I live, I'm in Brooklyn, New York, looks at just one statistic that I'll share with you is around how different populations are engaged in the New York area. So Bronx is one of the poorest congressional districts in the US. And every year, as we kind of look at who shows up to vote, we see that in the Bronx, it was about 56% of participants were able to exercise their right to vote. Whereas in Manhattan, this is almost 10 points higher, it's 66%, right? And so when we think about what that has to do in terms of who's then counted and represented, and our colleague, who I think I just saw join, Alia Bhatia, often will, of VoteER, often will say, when you show up, when you register and you vote, even if you don't get your kind of politicians elected or you don't get what you wanted done, just the fact that your numbers are counted mean that those elected officials are more likely to pay attention to your neighborhood going forward. So what does it mean that a neighborhood in New York that's historically disinvested in also ends up showing up less at the polls? Again, the question, are there structural things in place that prevent people from going to vote? And how do we really think about addressing those? We know that healthcare, and I'm just going to go back to this, is a place to really start to think about how we can make changes here, because there's a huge amount of trust in healthcare. Even now, even though people are anti-science and have lots of thoughts, there is still quite a sense of trust in healthcare settings. So we have been thinking about kind of, and I hope I've made the case for you as to why civic engagement in healthcare settings are so important. We've been thinking about how we bring it forward, how we bring it into education, how we bring it into training, and it has to be actionable. And so I want to just kind of say right away as you're listening that there are ways that we can integrate this into the work that you do as you do it now. If you're at an academic center, or even if you're at a clinic, an FQHC, there are talks that we can do that, again, make this case, bring these examples, do these teaching in lunchtime guest lectures and small group discussions. We've joined morning rounds and done this for just 5 minutes to tell people why this is important, to remind them to vote, to walk them through voting. And that's the way that we've been able to get healthcare workers kind of engaged throughout the way. So I want you to be kind of listening to this and thinking, okay, this isn't just like we should do this. How can I make this actionable? So we're going to talk through how we do the work. And one of the first things I'm going to talk to you about, just get it out of the way, is voting and the importance of voting, and as voting as a place to start. So Healthy People 2030 talked about the importance of voting, not only for creating a sense of community and connectedness, but also the impact that it has in really being able to tie people to the different issues that they ultimately care about. And so we, and there's a mandate from Healthy People 2030 that others have really kind of worked on to make voting easier, to make it so that people, there's almost like credit that's given as folks are able to vote and vote collectively. To kind of just emphasize the importance of this. And so how do we make it so that when you get your driver's license, you're automatically registered? When you go on to certain governmental websites, there's a natural way for you to be reminded to register. And the advocacy that's gone into Healthy People 2020, highlighting the importance of voting, is because we know that that's really the floor. Voting is the floor from where we start. And I want to say, if you're like me and tired of people kind of yelling in your face, vote, and then watching gerrymandering and all these other things happen that really make you feel stripped of power, that's okay. It's okay to feel that frustration. But it's a reminder that voting is, in some ways, an easy win. Registering and voting is an easy win. And it's in part because of this, what we call the policy to health cascade. So we start down here. Many of us see the impact on population and individual health outcomes with things like laws about reproductive rights or climate change or gun rights, right? We understand that these laws are implemented by institutions and individuals, usually by institutions. These requirements are made from kind of policymakers. And the ways that we then tie into what policymakers will do or won't do is directly related to voting. It's related to a lot of other things as well that we're not talking about here that Rush is going to get into more for you. It's related to lobbying. It's related to the whole kind of, legislative ecosystem that many of us gladly don't have to think about all the time. But voting is one of the things that is an important lever to be able to do this. So I want you to kind of stop and take a breath, take a look at this checklist. And there's some things on here. We built this this session so that there's just kind of actions that are placed in here as you go along, right? And so in this checklist, there are 2 very easy things that when you are done with this lecture or with this training session, we want you to make sure that you've done. And so 1, are you registered? And 2, do you have a voting plan? And we always mention the voting plan for folks who are healthcare workers, because if you're like me, you will be unlucky and have a lecture election night, or you will be on shift election night. And so thinking now about those 2 commitments is the very least we can do, because for the 36 of us that are in this room, if we both kind of lock those things in, if we all locked those things in, that's 36 more people who we know will kind of have the baseline power that's important to have. And then there's a couple of other things that we will kind of massage out for you, like who's on the ballot, how can I work to meet my council person, because those face-to-face meetings have a huge impact on them knowing that people care and them showing up to vote in certain ways. How can I join community advisory group or action groups that are doing this work? Are there town halls that I should be showing up at where decisions are being made? So this is a comprehensive list, and you can kind of hold on to it as we go along, and we'll come back to it. And we'll share this with you afterwards. But I want to say, if there's nothing else that you do today, if there's nothing else you do this week, this month, just those two things will have an impact given some of what we set up. And so I'm going to turn it over to Russia to talk through some of the additional levers and to give you some case studies. Russia?
Hi, all. I'm going to share my screen really quickly and pop up in this slideshow. Perfect. Can you all see that? Perfect. So some of the additional levers that we have are, the first is what we have is our legal guide. And lots of folks in this environment have said, well, how can I do this work? Where's the legal guidance? I'm a little unsure, like, what can I lean on? And so we created this easy to use resource that lets you know that if you're a publicly health care institution, that you are allowed by the IRS code to have a voter registration drive in your so long as it's done in your center in a nonpartisan way. We have a number of other resources and tools on our website that you can use, but I think the legal guide and just looking over these quick bullets is something handy for you to have in your back pocket. It's really easy to use. So if you're thinking about doing this in your setting or in your institution, you have something to come back with. Say, hey, I've looked at the IRS code and it says this is allowable so long as we do it in a nonpartisan manner. Some other things that, thinking about what holds us back is, lack of experience, not knowing what's allowed. Some of the things that we talked about earlier, a lack of time, and not even having enough role models to do this. And so we're going to walk you through some practical and easy to do examples of how you can do this in your care settings. And the first one that we really want to focus on is the legislative impact, and really thinking about the impact that healthcare professionals can have in legislative sections and in legislative areas. So how does the legislative branch influence policy outcomes? The legislature does this through policy bills, resolutions, ordinances, and they also do this through budget appropriation. So the way that they allocate funds. How can healthcare professionals influence these outcomes? They can do this through phone calls, meetings with legislators, submitting letters on public comment, participating in other public forums with a legislative official, asking a legislative member to come out for a tour of your facility. If there's something specific that you guys are seeing in your setting, you're saying, hey, this may be of interest, invite them out for a tour. They would be happy to visit you in your setting. Some of the best practices, so we've studied some of the best practices that elected officials like to be engaged with, and the study was specific to folks who are not used to engaging with members of the legislature. So the types of information that they really like from their constituents is they really like local demographics, populations that are affected, and their causes of health issues. They like to hear about disparity information and understanding the severity of the issue and any cost or benefits or other economic or financial impact data that you could share with them. The mode of communication that they prefer is proactive oral communication. So think about phone calls, in-person meetings, tours, presentations. One thing that I like to lean on is a lot of you guys are working on lots of research that you're seeing in your setting. If you're starting to come up with some research findings or some clinical research that you're doing that may be important for a legislator to know of, share your research with them. Hey, this is a policy brief that I'm working on. This is some research that we're doing in this field. I've seen you guys have kind of talked about this. Happy to sit down with you in the future to delve deeper into this research and the findings that we have. How legislators like their information. They really like succinct one-page documents. Like us and like you, they're busy as well. So the more succinct, the bullets that you can use, policy briefs and handouts. They're really tactile, but they like it short and in bullets. And I think that's stuff that you guys can pull easily from your settings. As healthcare workers, what makes it hard to do this work? We've heard that, time for follow-up and building relationships with elected officials. We know you guys can do this work, and it really is just setting the really small seeds. Like, hey, I'm an expert in, as like Stella would say, HIV primary care. I hear this is something that you're interested in. This is some findings that I'm aware of. Let me know if you have any other additional questions. Very, very simple. Something that we like to think about briefly, I won't go in too detailed, just to think about the other branches of government, is the executive branch and the executive impact. This is the branch of government that's responsible for policy implementation. So the legislature passes the bill, the executive branch has to now implement it. What we can do there, and oftentimes a lot of us policy advocates really drop out at that point, when I always say it's probably the most important point. And this is really just getting to know the people who are responsible for implementation, getting to know them, meeting with them, letting them know that you're there, that you're available, and you're a resource. Another area is the judicial impact. So a lot of folks are like, judicial branch, what do they do? And one area that I like to encourage health professionals to think about how you guys can lean in your expertise is thinking of aiding in an amicus brief. And so what that can look like is, for example, I can use a CHA example that we've used. We were a part of an amicus brief discussing the importance and the impacts of mifepristone in reproductive health care. And so this amicus brief was submitted to the court just to provide issue area expertise on, this is the drug, this is what it does, this is what we know about the drug. These are things that you should be thinking about the drug as you analyze this case from your perspective. So let's do it. Let's apply it. One way, and we'll have Jessica from our team, she's dropping a lot of these links in the chat so you guys can have access to them, is orienting you to your legislature. Lots of folks says, I don't know who my representative is. I don't know how to find them. We're dropping a link in the chat on where you can find your state and local elected officials. What we want you to do quickly, you don't have to do it now, but at some point in time, is just write down, who are your elected officials? Who's in the upper house and the lower house? Oftentimes that's who's in the Senate, who's in the Assembly. If you're thinking about a local level, if you're thinking about Congress, who's sitting on the House of Representatives, who's sitting in the Senate. And review their websites when you have time, just quickly. What are their issues? What are they like? What are they talking about? What are their bills that they're following or that they're making, just to get a sense of where their interests are and see if you align with any of them. Another couple of things that we'll do is a legislative issue-based walkthrough. So I was thinking about ways to how do I re-engineer this work when I'm working on it? And so a lot of times folks are like, how do I find information? How do I find a bill? Where do I go? And the first place I've started when I was thinking about, what's a state? Mississippi. What's the policy area? Elections. So I immediately thought, go to the Secretary of State website and see what any press releases that the Mississippi Secretary of State had. What are they talking about? And so I found a press release where they were actually talking about a legislative item that they were proponents of. So I went to the Mississippi legislative system. And then after that, I found that they were talking about this bill, and it was House Bill 1310. And they were arguing about how this bill was going to be great for the electorate in Mississippi. So I pulled up the bill and then I started reading the bill. I won't give you my policy thoughts on the bill. I'm just walking you through the thoughts of how I re-engineer this and how you could easily re-engineer this in your own setting. So when I go through the committee, the bill, then I was like, okay, well, how do I find this? Where is it at? Where is it in committee? So what are committees? Like these, now we're getting really into the weeds and the details of what is how do you walk through this process? And it's really just a group of legislative members who are appointed to a committee and they debate and report on this specific issue. So the committee that I was concerned about here was the elections committee. What were they talking about in this House Bill 1310? And then I put in here a link of how do you find committees that you're interested in. So one thing we'll do, just thinking about to yourself, is identify one local or national policy issue that concerns you. You can drop it in the chat. You can let us know what is something that you're concerned about, and it can be local or national. And then you're going to want to think about and brainstorm potential solutions. What are some solutions that you have seen in your setting that could be viable solutions? And then where would you get the evidence? Where would you pull potential evidence from? And then consider any past successes or failures that have happened in this area. And then what we want you to do in the chat, if you can, let's see if I can see anything in the chat. Ooh, climate change, it keeps you awake at night. Okay, so I have something for you on that one. Oh, I see someone else is putting in great old menstrual product accessibility. Yep, reproductive health. And then what you want to do is share and collaborate your ideas with the group. So thank you. So we're thinking about our summary. So as we go through this and our summary and our ways to engage. So we've talked a little bit about voting, how you place phone calls, to place phone calls, to have meetings with elected officials, to have meetings with staff, providing testimony or public written comment, writing an op-ed, donating to a campaign, writing other types of letters, and then asking an elected official to come out to your site for a tour. I think that's got to be my favorite thing, because when they're in the off season, elected officials are looking for things to do. If they want to be beholden to their constituents, they would love to walk around with someone in a white coat or a student or a trainee and walk you through your facility and say, this is what I'm seeing. We're seeing this unhoused population come through my door day after day, and these are the issues that we're seeing in the clinical setting. We want to start to alert you to them. So I'm going to share a lived experience of community and civic engagement. And I want you to think here as I'm going through this, because I'm going to ask you a question towards the end. How could someone in your situation, a health trainee or someone in the healthcare professional, how could you have lended your voice to this situation? And how could you have been helpful to this situation? And so this is something actually I personally experienced and I personally lived through. So I was living in an unincorporated part of LA County. And what happened at the time was we saw vacant land rapidly transform into a cargo site for storage in the local community. So if you look at these pictures here, you'll see that there's an apartment complex here, and then you'll see a number of trucks right in the back. And then if you look at this small complex here with these homes, you'll see trucks, freight trucks all along the side. And what we were noticing was that the trucks were being able to be stacked 3 or 4 high, and that they were increasing noise congestion, increasing a lot of pollution in the neighborhood, and were causing severe traffic safety concerns. So there were even here, and right behind here is a Catholic church and a private school. And so students that were getting walked by their parents and grandparents had to fight oncoming traffic to get around these trucks. So it was a huge issue. And we're like, what is this? Because it happened overnight. So what we did was we had to obtain some documentation, how did this happen? Where did this come from? And we found out that it actually came from an executive order that was issued by the governor of California. And why he was doing it. He was doing it to ease congestion at the port of Los Angeles and Long Beach because of the COVID-19 pandemic had resulted in a lot of backlog out on the ports, but they had to get that freight off the water, off the land, and in somewhere. So they had to store it in these places in the city and in the county. We also did what we call is a public records request, or a PRA. At the federal level, it would be a FOIA. And you can request information from the government. And so we got a copy of the lease agreement. What are you guys doing with this land? What's happening? Just to understand some more information. After that, we had to study and learn. And this stuff takes time. But what we were able to study and what we were able to learn was that the increase of presence on the supply freight drove up the diesel exhaust in the neighborhood and contributed to various health problems. What we were also able to uncover was that long-term exposure to diesel exhaust poses the highest risk of cancer of any toxic air contaminant. We found out that there's 3 agencies within the state of California. So the Department of Toxic Substance Control, the Air Resources Board, and the Office of Environmental Health Hazard, they all agreed that exhaust from trucks contributes to a range of health problems and can lead to the irritation of, as you all probably know, eyes, throat, nose, heart disease, lungs, and contribute to cancer. We also found out and uncovered that the activity was occurring on polluted land. And so there was groundwater contamination and soil contamination on the sites where you guys saw the pictures of the freight. So what did we do next? And this is a whole host of activities that we did. We activated. So we met regularly and attended community meetings to understand the scope of the issue. We developed relationships with government officials who are responsible for implementation. So the executive branch, that here in the state, it would have been mostly on the transportation side, to obtain the facts and advocate for the cargo removal. We canvassed our neighborhood and we made direct contact with nearly 200 residents to inform them about the issue, and understand how the cargo was affecting them. We created an online petition, a Facebook group, and an incident log for residents to document the impact that the cargo was having on their daily lives. We were able to arrest the attention of our elected officials through letters and phone calls. So we had this thing where it was, I think it was called something phone call Tuesday. It was a jazzy name that folks came with. And so every Tuesday at a certain time, we all agreed to call. And so every Tuesday, everyone would call elected official. And then we were able to secure the focus of a local task force. It was the Los Angeles County Community Prevention and Population Health Task Force that took a severe interest in this. And then we were successfully acquired the attention of a national nonprofit civil rights advocacy organization to help elevate the issue on their platform. And it was the Color of Change. And so what we did was we created sample communication. And the reason I want to share this sample communication here is because when we're thinking about ease of use and ease of tools, having sample communication that organizations like Civic Health Alliance can create with you, and then you distribute, makes it very easy for someone in your situation to be able to participate in. And so what we just did here was an example, like, who are you? What is your name? A little bit about yourself. What are the impacts of the freight chokes that are having on you and your community? And then what do you want? We want your office to stop the trucks from driving down. We want you to remove them. And we want to recover the land for community control. Very simple. We helped create those talking points and then shared them with community members. So when they made those calls, they had something to go by. Stella.
Sorry, Russia, it's just the bottom of your slides are cut off, and so I've moved everything up for you. So if you don't mind just stopping sharing and sharing again, I think all of them will come correct again, but it's such good information. I don't want folks not being able to see it. So just share again and issue work.
Yeah? No.
No, it's still the same. I think it's your formatting. Don't worry about it. Keep going. We'll get folks the right one.
So what we were able to do was have some outcomes. So the California Department of Transportation agreed that they would not renew the lease to the land for the cargo site. The freight has not been completely removed from one site, and it has been completely removed from others. So the community has been able to get some forward movement. So what next? What effects has this already had on the community? And what about the other non-state-owned sites that are out there? And those are the things that the community is still working through, although they've had some success. The questions that I have for you all, and you can drop them in the chat, is as we're considering this issue and we see that there are recurring health issues that could affect the community, are there local organizations or community areas that you're working on where you could lend your voice or expertise? And then how would you build relationships with local organizations or community groups who are working through these types of issues? And I'm going to check the chat to see if anyone is putting anything in there. Let's see. What would you guys do? And you can use this as an example. How would you help us along? And if you can't think of anything, I'll share one idea that we had. There was a community health clinic that was actually within the radius of where we were working. Yes, salaries and job security for community health workers. We love our community health workers. There was a clinic that was nearby. And the one thing that we hadn't had the ability to do or hadn't had the capacity to do was actually go make a relationship and talk to the health clinic, because what would have really been helpful was that the same people live here. A lot of those people, a lot of those residents still go to that clinic and said, hey, this is what we're seeing. This is happening just down the street from the clinic. how can we engage you and how can we help you? And so I think it's a two-way street, community groups and just coalitions of groups and civic engagement groups, knowing that we can reach out to the clinics and folks in clinical settings. And then also working with you all to say, how can we get your support and how can you lend your voice here? Yes, neighborhood council and community. We have these in Cincinnati. Yes, yes, those are great places to lend your voice. And so this is where we're getting to the point of our discussion and questions. Building off of this one example that we've already had and building off of the conversations that we're having in the chat, how would you all think about applying civic engagement in your settings or supporting other community issues?
Yeah, and feel free, because I think, we built it so that we have some time for discussion. Feel free to share things that you've tried that haven't worked, because we are finding, especially as we're moving along, that some avenues that were previously open before are now closing. For instance, we had a colleague who was in Dallas, Texas, actually, who was able to successfully have a voter registration booth in 2020 at her clinic. And then in 2022, when she went back to set it up again, the institution absolutely declined. They said that it wasn't going to be allowed, and they didn't cite a reason, but just said that it seemed too political and they weren't going to do it. And so in just those 2 years' time, something that had been allowed had changed, and it tracks with some of the changes that we're seeing kind of nationally. So feel free, to Rusha's question of like, what are you thinking, what could work, to also share what's been challenging and what hasn't worked, because I think that there's support and conversation we can have around those as well.
I see someone in the chat saying medical professional societies, they motivate greater civic engagement within the profession. Correct. Let's see. Melissa says, I guess I had not considered it civic work, but I have recently advocated for elderly in the nursing home due to low direct. Let's see. My eyes. Patient care numbers. I've contacted local representatives and CEOs of NTL's organizations. That is it. That is civic engagement, Melissa. That's exactly what it is. Yeah, you net it on the head. Yeah.
Not
Yeah,
only
we'd
that,
love if you shared that story.
Yes, and it hits extra when you can say, I'm a nurse in the community, I'm a community health worker, I'm a clinician. I think all of those years of training, this is where you get to use it. One of the things I do want to mention that Russia talked about that really always impacts me is that slide where she shows all the work they did to kind of learn about the impact of diesel fuels on community health and kind of making those connections to health. And that's always a space where we think a little bit about like, this is literally what some of us have trained for. This is literally what some of us research. And so there's this real kind of invitation that if you want to be civically engaged, it doesn't mean you have to start from the beginning and build a whole coalition. Sometimes it just means that you show up and bring your expertise. And again, your credentials, your voice, that fancy title that you spent your whole life getting, to a movement that's already in place, that's happening. I think that that's just incredibly important as well. And I see some more comments coming in. Rusha, do you want to read the one that just came in? Or you want me to read that?
I says, let's see, Julia accidentally went to a crisis pregnancy center in college and was disgusted by how predatory and shaming it was. I wrote a testimony about how horrible my experience was, and someone presented at a press meeting in Harrisburg. Now Governor Shapiro ended an almost 30-year-long contract PA had the crisis centers. With the crisis centers, I know so much more went into it than that one testimonial, but hearing about the contract ending and being able to write the testimony made me feel pretty happy and fulfilled. Yes, and I think having that personal voice and that personal touch, that is civic engagement. That is civic engagement. I have an example of my sister recently. And so she called me and said, oh, my packages have just been stolen off my porch. And I was like, that is so strange. And so she went around the neighborhood and started telling the neighbors that her packages had been stolen. And I told her, I said, well, what you may want to do next is just reach out to your local elected officials just to let them know, like, and contact the sheriff, contact the police and say, hey, I don't know what's happening. Could you guys bring an extra patrol car out? But we're seeing an increase in packages being stolen. I don't know if she did it or not, but she then sent me an email with a screenshot. And her Congress representative was like, we've seen a lot of package thieves in the area, and this is what we're doing about it. And so I don't know if it was her or if it was other people in the community just raising this up, and the elected officials were in response. And so it happened. I mean, I think that the one thing that I think we forget when we're engaging is it doesn't have to be a whole lot. It just really has to be your personal experience. This is what I'm living. This is what I'm seeing. And like Stella said, from the medical perspective, you guys have a level of expertise and subject matter expertise that maybe in our instance, we wouldn't have had to do a lot of research. Have I been able to call one of you all who's like an ear, nose, and throat doctor and said, oh yeah, we know this, here, take it. And I was like, oh, great, we got it from trainee so-and-so. So I think those are the things that go very far. Stella, is there anything else in the chat? I'm trying to catch up.
There's Lahari had a comment.
Let's see. For medical students who don't have much expertise, we've implemented an op-ed writing program. Yes, and it's been great to uplift the causes we're thinking about as the policies we are advocating for are being implemented. Beautiful, beautiful. I like op-eds. They're poignant, sorry. Let's see. Carson, I was part of a medical debt relief advocacy effort where we showed up to city budget public hearing to provide testimony in support of a proposal. Yeah, that's engagement. Yeah, when doctors tell stories about our patients and obstacles we face in treating people, it can have a real impact on politicians. It can. It can. It can. You guys are fantastic. Why are we training you? Why? And so I want to do a quick a summary of some of the community engagement and civic engagement pieces that we talked about, and ways to engage on the community level. And it's consider what is impacting your community. Like, look around you, you see this stuff every day. What's coming in your door? What are you studying? And then learning about the local issues. And it's probably even more not learning about the local issues, that because you're there, and it's just thinking about them in a different way and looking at them from a different lens. And then attending, not like you have anything else to do, but attending community events and meetings when you can. And then I think most important is lending your voice on issues and on your communities already facing. You don't have to recreate the wheel. You do have subject matter expertise. I will say that over and over. What is happening in your community, you can simply lend your voice to what's already happening.
Awesome.
Let's see.
As we get ready to launch the last poll, I just want to mention that we're sharing some information for you to leave feedback if you would like to, because we always love to hear from folks about how these sessions are, what else we can add and what we can do. And the second thing I want to just note before we get close to wrapping is that we are one small organization of many that are out there. I think many of you that are on the call probably know VOTER, as well as a public health facing version of this called Healthy Democracy, Healthy People. We'll drop both of those links in the chat as well. But I mentioned those because I really want people to feel like, oh wait, like I haven't really been working with Civic Health Alliance, but I have the VOTER lanyard. Like, is that good? Yes. Like all of this, every little bit, all the investments that you make are incredibly helpful. And I think, as Russia was saying, this group is very activated. I mean, people are writing testimonials that are getting unhelpful partnerships changed and doing op-eds. Like, y'all are doing amazing work. The next step is to think about who else you can bring in, right? Who else you can help kind of come on board to do this work. And that the legal guide that we mentioned is particularly helpful because one of the first things people will say to us is, am I allowed to do this? Is this okay? So with that, we're just going to launch our last poll question. Russia, please go ahead.
No, it's okay. Let's see how to launch this poll.
Oh, I can do it. I got it from here.
Oh, you ready? All right.
Yeah. So after this training, I feel prepared to bring civic engagement to my healthcare institution, school, or to engage with elected officials. And it's okay if you're still neutral or if you need more. You can tell we're very hands-on, so we could spend one-on-one time with you if you would like. And so we just want to know kind of, if we've been able to move a little bit as we've been going forward. Wonderful. So what we are seeing is pretty good. I think 60% feel like yes, definitely. 50% of folks who responded feel like yes, somewhat. And so this is movement. And then again, we're not all going to be Russia. Russia won't shout herself out, but I'll shout her out for you. She testified in front of a local city council and did a brilliant job and blew us all away. And not all of us are going to be at that level, but as you've all expressed in the chat, and as I can just feel from the energy in this virtual space, y'all are already moving the mark in the different ways and in the different places that you're in. And this session is really meant to say, we need this. There is a direct connection between civic engagement and health. If not now, when? And as we head into another mad election year, it feels really important that we all are armed with the different tools that we'll need to be able to do this work and do this work well. So again, we encourage you to please share your feedback and let us know how we've done. And we're going to pause here and see if there's any final questions, any affirmations, any things you want to share about this session. And please feel free to come off mute and just share and say hi to your fellow colleagues who are, doing this work alongside you. And I'll drop the link for the feedback again. Thank you all for being here. Thank you, Julia, Caroline, Carol. Thanks for all the information. We appreciate it.